and the patients are there and the doctor's assuming that they know why the patient's there, maybe what the medical assistant wrote down or whatever, right? So I go into the room, and so do the rest of the practitioners, and we sit down and we're like, okay, I think I have an idea of what you're doing here, but I want to hear from you. Like, what are your goals for yourself? What is a win for you? And not only that, how do you see me getting involved in your journey? If you just say those words, first of all, the patient's going to pause. And that's a good thing, because it really gets the patient to think that, oh, this is my journey. So I'm the actual hero and you're here for a guide. And then they will actually put you, like subconsciously, they'll put you into the guidance position. So when you're in the guidance position, the rest of the conversation is kind of set, right? Which means that you basically redefine the value of you either writing a prescription or a supplement or a protocol or whatever it is for the patient into just the conversation, this feeling of safety. So a really good example of doing this is I had a patient comes in, and this patient had a specific medical condition. She had hyperthyroidism, and she comes in, and then she had all these different data sets here. And she's like, you know what? I want to do this like fully naturally. And I don't want any medicines. In fact, I don't want any supplements. I just want to do through food, right? And so one part of me is like, well, it's really hard to do, and I don't really suggest it, but that will be playing a hero. So the guide comes out, is like, you know what? I have never carried a patient in your position dealing through just food. And perhaps there's things that I don't know, but someone else would know. So and then I kind of refer this patient to like a full naturopathic doctor and stuff like that, right? And so that is a really good example of you're actually letting a patient go, but you just provide this patient a lot of value. How do I know? Because 2 minutes after she left, she gave us a 5-star review on Google, having me just telling her to go see somebody else. Like, who does that, right? And so it has to do with the value that I provided for her. Was I connected with her, and I wanted her to succeed. And I told her, really want you to succeed. But guess what? You know what? Someone else can do it better. And that value is just as high as if you put them on a supplement or eating plan or protocol and stuff like that. And that's what I really want doctors to understand.
That's powerful. Well, let's jump into coaching here for a minute, because one of the conversations that I've really enjoyed with you over the last couple of years is where you're literally like on the inside to understanding how CMS is dealing with coaching and what's changing in that world and how they're coming around to the value of coaching. And I know some of that starts with your data set. And I guess for you to be in the rooms that you find yourself in, right, where you're sort of, connecting, I guess, CMS and Medicare, and then like, the National Board of Health Coaches, right. I guess you're in that room because your data set is pretty critical to all of them to understand what's really happening. That's my guess, right?
Absolutely. So the national discussions around health coaches and reimbursement, a lot of the legwork has already been done. Margaret Moore, the National Board of Health and Wellness Coaches, and the Well Coaches Program, a lot of that stuff was done even before I even knew what functional medicine was, right? So that legwork was paved. So our new alliance, which is myself and representatives from like Mayo Clinic, my mommy's hospital in New York, UCSD, et cetera, we all kind of came together as a coalition. And this coalition actually looks at, hey, from a federal standpoint, what are the data sets that's really needed? Hey, what does Mayo Clinic need to put into this paragraph? What do we at Texas Center of Lifestyle Medicine need to put into this documentation to have a convincing factor that a lot of what we're doing is not only useful, but from a data set perspective, like millions of patient data set, not like thousands, like millions of patient data set. What does it do it from a national standard, and creating the actual national standard? So I'm very fortunate to be part of this conversation, most of which I can't repeat right now, but just know that the health coaching movement is only moving forward. It's really the wave of the current and the future. So, and then the second thing that I really want people to understand is that 2023 is even going to be better than 2022. That's all I can say for right now.
That's really exciting. So, I guess, I think one of the things that you've done is like you are a guide, right? And yet you employ guides. So you know that you can do it, but yet you choose to have these other people do it. what do you see as the benefit of having coaching be a discrete role in the clinic, as opposed to an acupuncturist coach, a chiropractor coach, a physician coach, a dietitian coach, right? Where some other expert is also playing the coaching role.
Well, your book is called The Community Cure, right? So part of the being in the community is that people needs to have established community first, because I think the essential tool to communicate with humans in general is to have one path forward, right? And I think health coaches are that voice of sort of this one path forward. But then you can have now add-ons for acupuncture and et cetera, as part of the main language that's really right there. Honestly, doctors are not great at that language. I'm trying to change that right now, but doctors are not great at that language. But the value proposition for the entire community is that no matter what, we will be here for you. It is still your journey, but we will be here for you. We may not have all the answers, but dude, we're your support team, right? And that's the community, and that is the community language that really should be established with the patients to drive forward. So if you look at other types of non-medical stuff, right? If you look at like religious leaders, if you look at Boy Scouts and Girl Scouts and stuff like that, these people act as guides within an actual community. We really need to change that mindset for the doctors to really adopt the same role as well as a community leader, not just taking care of my patients, et cetera, but like, what does the voice of the community really look like? And this is actually scalable in 2022, because now you have like remote therapeutic monitoring, you have tech, you have, remote biofeedback and all sorts of different gadgets that allow patients to have these tools to really utilize themselves to propel forward.
Yeah, that's cool. So, you mentioned a few, coding areas, and I guess I just wanted to jump into that. And I know, you're actively involved in helping doctors kind of run functional medicine or coach-based medicine or lifestyle medicine inside the payer system. And that's obviously, a huge opportunity for scale and for growth of the community. We've spoken about that a couple of times already so far this year on the podcast. So, where do you see if you're a doctor really rethinking your next 20 years in practice today? I know I've heard you say this is the best time ever to be a physician entrepreneur.
Ever.
What can you tell us about, how physician entrepreneurs should be thinking about what's in front of them, and how can you, set yourself up for most success?
Well, it's very obvious that the country is pretty lost over the last couple of years since the pandemic, right? Because the main structure of the health economics in this country just went, it's like the bridge just collapsed, right? Yeah. And to the government, it's actually quite embarrassing, right? So if you looked at the behavior of CMS, Center for Medicare and Medicaid Services, what did they all of a sudden do that we wanted them to do forever? We wanted to make telemedicine a standard of care. They did it. We wanted to make licensure like super easy for docs and not like 11 months for me. They did it. We wanted to make reimbursement a whole lot easier. They did it. We wanted to make transparency of healthcare costs transparent for the patient. January 1st, 2022, we did it. No more surprise bills from CMS, right? Or for our medical practices, right? So all the stuff that the physician population wanted CMS to do, all of a sudden just magically happened within a span of 4 to 5 months, right? So is it surprising? It's surprising it took this long, but it's not surprising. Even the American Medical Association, their brand new 2021 CPT and reimbursement guidelines, which is the biggest change since 1993, was proposed in 2016. It was not until the pandemic they're like, okay, we'll do it, right? Yeah. Now doctors can bill like lawyers, which means that if you're spending time not just with your patient, but away from your patient or talking to other doctors about the patient, just like lawyers bill, you're actually getting reimbursed by all insurances, right? Now, how many people know this? Not many doctors know this, right? But even this morning, and I was calling a colleague of mine who's a sleep medicine doctor about the patient. Both of us can actually bill insurance for this patient with Medicare. It's called interprofessional counseling code. So there's so many opportunities that doctors are really missing out on in terms of like insurance billing and coding and stuff like that. that did not exist before 2021, right? And so in 2023, by the way, I told you it's going to be better because there's new surprises coming, which I'm really excited about. And so from a healthcare entrepreneurial side, we really have to just kind of re-examine what is the opportunity here for insurance in the United States, or maybe a hybrid model or something like that did not exist 2020 and before, right? So, and not only that, for the first time, there's now clauses within reimbursable data stating that if you collect information and data, even a questionnaire, these questionnaires can actually be billed to insurance. And guess what? An auto text is generating that questionnaire, right? And they're utilizing it for patient behavioral change. That's his own CPT code, right? And so all of a sudden, you have this massive explosion of tech that's able to scale a practice. And for the first time ever, one doctor, instead of taking like, 900, instead of taking care of like 900 to 1,500 patients, one doctor can take care of 10,000 patients, right? Because this doctor can become a guide, utilize technology information to basically curate paths for the patient. Now, this is all doctors. It's not just integrative or lifestyle medicine, but I think the functional medicine, integrative medicine, lifestyle medicine doctors who are trained have a huge leg up because they're already trained and obsessed about reversing chronic disease, right? And that's the value. And I think this is really the time where integrative docs like myself can really take what's already available and push it into the future. So, and I shouldn't say the future because we're already doing it here at Texas Center for Lifestyle Medicine. So push it into the current, right? And that's why I created, Integrative Practice Builder. So if you guys are interested, go to integrativepracticebuilder.com. And then actually click on my blog section. I actually talk about what I just talked about far more in detail and see what's really available for integrative practitioners within the insurance space.
Yeah, I guess that's such a good point. And I'm really grateful that you're opening the eyes of many physicians, like physicians that bill insurance, opening the eyes to lifestyle medicine coaching. And then, for doctors who have been doing lifestyle medicine and coaching on how to, operate inside the payer system and make it work financially. I think that's a big gaping hole that you're filling, and something that we, aspire to help, doctors to fill in their own gaps. So I guess the last thing I want to just touch on and get your thoughts on is, you're inside this ACO, so you really understand what's coming with regard to value-based care. And I've always thought that, the kind of moment where functional medicine would shine and functional medicine delivered in a different way would be when we were paid on outcomes rather than paid on doing stuff, because it's easier to do a heart stent than it is to do diet counseling. But if you can actually change someone's diet, the outcome and the trajectory is much different and much better. So tell me a little bit about what you've learned from being part of an ACO and what that means for the future of healthcare and how people are going to get paid and what skills will be most valuable moving forward.
So value-based care is basically, like you said, part of your reimbursement comes from the value that actually provides for the patient with specific markers, diabetes, you monitor, blood sugars, hemoglobin A1C, look at hospitalizations, admission rates, readmission rates to the hospital, ER visits, et cetera, et cetera. So all the things that are really costing a lot of money for the insurance companies and Medicare to take care of a patient, right? So now you have like the Medicare Advantage plans are saying that, hey, we're going to reimburse you based on the value that you provide. Now, it's not fully just value, because that was the truth. The doctor can see 6 patients a day and still survive. That's not true. It's still volume based, right? And so now there's sort of a intermixed in between. So being part of like accountable care organizations and IPAs, which is independent physician associations, because we have the tools to look at our data, I know if my patient gets admitted to a hospital 40 miles away, right? And then so I know when they're about to be discharged, and within 24 hours, we're either doing telemedicine with them or we're getting them into the office to make sure they don't bounce back.